Hey there, folks. Uncle Troy here. Quick note before I get started. If you know my girlfriend Samantha, she's been in the hospital the last few days. She had a heart attack. They've done an angioplasty and opened up her arteries again. But she's feeling better. In fact, I think she just called me just before I started this recording to say she's home again and actually going back to work, which makes her a better man than me. But for those of you that know Samantha, just send your thoughts and prayers toward her while she's recovering from her heart attack. Now on to the show. Hello there, folks. This is your Uncle Troy with another C Word update. For those of you not keeping track, the C Word update is where I talk about my battle with cancer. It's not one of the happy-go-lucky fun and games videos, so if that's what you're looking for, feel free to click away and watch one of my other videos. So today we're about a year after my diagnosis with colorectal cancer. Stage 4. For those of you who don't know, stage 4 is not the stage you want to be at. Technically, you don't want to be at any stage of cancer, but stage 4 is the point where the cancer stops trying to devour whatever organ it's in and sends out spores, basically, that lodge in other parts of the body and start growing. So you end up, in my case, I have spots, according to the CT scans, I have spots in my liver, lungs, and various para-aortic lymph nodes, which is in your stomach area. And basically, I don't have liver cancer or colon or lung cancer or lymph node cancer. I have colon cancer in my liver, colon cancer in my lungs, colon cancer in my lymph nodes. And so that's what we've been fighting the last year with chemotherapy. I'm going in tomorrow, probably the day this video goes live, going in tomorrow for my last run of chemotherapy in this run, last treatment in this run of thing. And then we're going for a CT scan, and then we'll determine what to do from there. Every CT scan so far has been the same. The spots on the CT scan are smaller and fewer in number than they were, but they're not as small as we would like them. So we're going to continue with chemotherapy, and that's how it's been every single chemotherapy or every single CT scan we've had. We've shown some improvement, but not as much improvement as we'd like. We're going to continue with the chemotherapy. Can you come back tomorrow? And basically that was one case I went to the doctor to discuss the results of the CT scans, and she basically said that and told me to stop at the scheduling office on the way out to start chemotherapy the next day. I don't like that. I like to have a few days before chemotherapy. Chemotherapy makes me feel bad. It makes me feel weak, tired, I hurt all over, and it just can't get comfortable. And so I like to kind of almost celebrate the few days before chemotherapy because I know that's as good as I'm going to feel for a while. So I like to get out, do stuff, whatever. But today I don't want to talk about the chemotherapy or the cancer. I want to talk about another health problem I've had, which is anal abscesses. Not too long after I started the chemotherapy a year ago, I started having problems sitting down. It hurt and had some tenderness down there. You know, parts of your butt are purely decorative and parts are kind of load-bearing. And this was in one of the load-bearing parts of my butt. And so I mentioned it to the doctor. They gave me some pain pills, poked around, didn't find anything really wrong. And this went off and on. Sometimes it was better, sometimes it was worse. Went off and on for a month or two. And then it got so bad one weekend, naturally when the doctor's office is closed and you leave a message and they never call you back. So I went to the emergency room with this. Of course, at the time I was also puking and pooping blood and generally unhealthy. And basically once they got me to stop pooping and puking, they were like, well, you're okay, you're not dying, bye. And so, spent the weekend, a Saturday night in the ER, basically to be told, here's some medicine to make you stop throwing up. We'll send you home because we don't know what's wrong with you. Which is basically the level of service I expect from an ER. If you're not dying, I don't expect them to do anything for you. And this is a man who's worked at a hospital for 19 years, and I know what happens in a hospital and in an ER. And basically, if you're not dying, you get better treatment if you go to your own doctor. Okay, so that was on like a Saturday, and then Monday I was supposed to go in for chemotherapy, but I felt terrible. And I called and told them I cannot come in for chemotherapy. I do not feel good enough for chemotherapy. And they said, well, come in anyway. The doctor wants to see you. So the doctor come in. The doctor pulled down my pants, checked my butt where I was hurting, and basically said, I think her next words were, "We need to get you into the hospital right away. Who's your surgeon?" And luckily, I had a good surgeon who had put in my purple power port, which is a little device in your chest where if you've got bad veins like me and they have trouble starting IVs, and of course chemotherapy is installed, well, basically it's intravenous. You're hooked up to an IV for hours to have caustic chemicals pumped into your veins, and they were afraid that would just tear up what little veins I had in my arms that were accessible anyway. So they put a power port in my chest. It's just under the surface. You take a big hooked needle, jam it through the skin of my chest into the power port, and it has a line that runs straight into my jugular, the biggest vein in the body. So, well, not the biggest vein in the body, but it's it's an important vein that goes straight to your heart. Technically, all veins go straight to your heart, but that's another story. Anyway, so the surgeon kind of took over while I was in the hospital and installed or prescribed, I should say, huge amounts of antibiotics. And I did not know at the time, but there was a risk that I could die. I found out later that the infection in my butt that was causing the abscess could have gone septic and gone system-wide, which means the infection could have spread to my whole body, and that could have killed me. Of course, nobody told me this at the time, just said, we're going to try to straighten out your problem here by giving you these antibiotics. But basically, something down there had become infected or something. We're not sure if it's because of the cancer, it's because of my brain just went red. Oh, because of the chemotherapy and my body's response to it, or if there was just a problem with my butt all along since I was born. But somewhere down there, some tissue decided to start leaking some fluid, and the fluid built up pressure, which was the source of the pain, and eventually forced holes through places where God didn't intend there to be holes in your body, and started leaking fluids, and that's why I had drainage, I guess you would call it, and pain, and blood on my underwear, and just generally feeling bad is because I had a bad infection that could have been life-threatening, but nobody told me at the time. So they gave me antibiotics for a couple days in the hospital and decided it wasn't getting good enough, fast enough. The fluids weren't draining fast enough and whatever. So general treatment of an abscess is to poke a hole in it and let the fluid drain out. And that's basically what they did. But they put me under general anesthetic, and the doctor went in and was supposed to make just one tiny little incision, and ended up making two very large incisions all the way down to the source of the problem, and where they debrided it. Debrided, I think debrided is the word. And they debrided it by scraping out basically all the infected tissue, everything that didn't look right, basically. And then they couldn't sew it up because it had to heal naturally. So basically they packed it full of gauze and sent me back to the hospital room for another 5 or 6 days. I was in the hospital for 8 days total, which was one of the more unpleasant experiences in my life. I mean, I've worked at a hospital for 19 years, but that doesn't mean I like hospitals or like being there. And being confined to the bed and with hooked to the IV, which is like a tether, you can't get up and just walk around. You got to unhook stuff and check with the nurse. Whatever, just going to the bathroom was a major hassle, which is why I got real good with the urinal. I know you didn't need to know that, but that went on for like 8 days, and they sent me home and said, you may drain a little, you may have some pain, you may have some inflammation, here's some pain pills, have fun. And what happened is, over the course of the next, several months, we'll say a year, basically some days I'd have good, some days I'd have bad, some days I'd have some pain, sometimes I'd have some irritation, sometimes I'd have, and that would be regardless of what I was doing, it would just hurt. And some days I would have irritation just when I sat down, it would hurt, because I said this has happened in a load-bearing part of my butt. And some days it would drain, and some days the drainage would be clear, and some days the drain would be kind of bloody looking. And the doctor said, I'd go back to see the doctor about every month, the surgeon that did this, and he'd poke around and say it's, getting better. It looks better than it did last time. Until about a month or two ago, in which case he said it wasn't any better than the time before. And what we'd hoped would happen was that starting back with the deepest incision, where they went all the way down to the source of the problem, what we were hoping would happen was that the skin would start to heal and would heal on its way out from the inside out, and that there would be no more abscess, no more open areas for fluid could pool up, no more, and eventually, once everything was all healed up, no more drainage, no more pain, no more sensitivity to pressure. And what actually happened was that it kind of half healed up. I still have what he thinks are pockets inside my butt where fluids are draining from. And he saw me the last time, last week, one of the times that it was feeling particularly bad, particularly sensitive. I hadn't sat down in like a couple of weeks. I just spent most of my time in bed. And it had been draining really bad, and there was a feeling of pressure, a feeling of tightness, a feeling of heat. And I should have recognized this as signs of infection, but I did not. So the doctor, he poked around quite a bit, and which was, not very comfortable, let me tell you. And examined the stuff he managed to palpate out of me, the bloody pus, and not installed. I keep wanting to say installed for some reason. Prescribed me a batch of amoxicillin, a powerful antibiotic, which for some reason he thought I was allergic to. And even though it's not that way in the chart, he probably was confusing me with somebody else. But I then come back in a few days. So I took the amoxicillin for a few days. He poked around. It was much less unpleasant because I wasn't sensitive to pressure anymore and it wasn't hurting. And he described the discharge as much less pussy, which means hopefully we're getting better. So, but it wasn't as good as he would have liked to see. And I'm just tired of hearing that things are better but not as good as we'd like. So anyway, he told me to continue the antibiotics and come back and see him in another few days, about the time the antibiotics run out. And since we started the antibiotics, I've had a lot better, feeling better overall, a lot less pressure, pain, a lot less drainage, and so I think that it's a problem that there was an infection down there that wasn't. I'd been going to a different doctor for my cancer treatments, and they'd been taking blood all the time and checking my white blood cell count and telling me it was normal, which I would think would mean that I was not infected with anything, but I don't know. That just means the body wasn't fighting the infection, or that the body thought that the level of white blood cells it had was sufficient to deal with the infection. Thank you very much. We'll take care of this. We know what we're doing. You don't, which is generally the feel I have toward my body, that it knows what it's doing and I don't. But anyway, and as he felt around this last time I visited him, he said he could feel a soft spot, which he thinks is one of the pockets that was filling up with fluid, which I think means he knows where to cut the next time he has surgery. And he mentioned surgery as a possibility, and he asked me about my chemotherapy schedule and when the next gap in it was, which when a surgeon starts telling you when there's a gap in your schedule, that usually means he's going to cut on you. But the hope is, and he crossed his fingers when he said this, is that the antibiotics will do their job, things will clear up, there won't be any discharge, or at least painful. It won't be painful, and that I'll continue to heal. But if it doesn't, then he wants to go back into the hospital. He wants to have me go into surgery, and he wants to cut on me again. That being him being a surgeon, that's his hammer, and then my butt is the nail of his problem. Is that he wants to cut me again and hopefully open up the areas that he's discovered, clean out any infected tissue, debride it, and hopefully make me feel better in the end. And in the end, that's funny. So that's where we are right now. Quick recap is it's been about a year since I've started the chemotherapy. We're going to do one more run of chemotherapy this week, and then a CT scan next month, and then we'll know where we're going from there. Hopefully the CT scan will show that we're continuing to reduce the size and number of spots in my CT scan, the metastasized lesions from my colon cancer, and I still can't get over how I have cancer in my liver and cancer in my lungs, but I don't have liver or lung cancer. I have colon cancer in my liver and in my lungs. And the related or possibly unrelated problem of my anal abscesses is continuing to be a problem. I'm seeing the doctor about it. Again, here in the next week or so, I'll know something about whether or not it's healing up enough that I can continue on with what I'm doing, or if we're going to have more surgery. Hopefully it'll be like a day surgery, or just stay in the hospital a day or two and not one of these week-long stays like I had last time. So that's where we are. I apologize for the lack of updates, but most days it hurts to sit, so I don't want to sit in front of the computer and work on my videos and whatnot. I just want to lay in bed and watch TV and feel sorry for myself. That's why I still need your thoughts and prayers. Just send warm thoughts toward me. I know scientific study has shown that prayer doesn't help, but it helps me feel better knowing that you're out here. So just thumbs up this video, like on the Facebook page, whatever, and just show your support, and I will appreciate it. This is Uncle Troy signing out. Please have a good night.